Good evening, everyone. I'm Dr. Rituja Thomas Grover. I'm an orbit and ocular plastic specialist at the Vision Eye Centers in New Delhi. Today, we will be talking about something called blepharitis, and it's usually more common in the winter season. So, we'll have a little chat about blepharitis. So, what is blepharitis? It's basically the irritation of the eyelid margins and the consequent flaking and sort of dandruff like particles which are there on the eyelashes. This can cause inflamed eyelid margins and consequently a lot of watering, irritation, and discomfort to the patient. So, how can you identify if you have blepharitis or not? So, it's difficult to identify on your own. However, the symptoms that you may have are itching and a burning sensation in the eyes. You may see some redness around your eyelids. There may be some crusting on the eyelashes, and you can have a bit of blurring of vision because of the tearing and a bit of foreign body sensation because those particles sort of fall in the eyes. How we pick up blepharitis is that when you come to the clinic, of course, you'll come with these symptoms. We will also look at your eyes on a biomicroscope, that is the slit lamp that we use. So that magnifies the eyes for us, and we look at the eyelid margins. So what we need to mainly look at in the eyelid margins is again the kind of swelling which is there, the root of the eyelashes, how much of particles are there in the root of the eyelashes, how much scaling is there around the eyelids, if there is any loss of lashes, change in color of the lashes, change in the direction of the lashes, any blood vessels which are more prominent, um, any of the oil glands on the eyelids which are capped, any scarring which is there on the eyelashes. These are the things that we look at. So, blepharitis is mainly of two varieties. One is the acute one, which comes because of infections or um, parasitic infections and other infections like bacterial infections, viral infections. And it can also be because of a certain skin condition called rosacea, which causes a seborrheic condition. So basically, like how you have dandruff in the scalp because of the constant shedding of the scales in the scalp. Similarly, you can have a condition in the skin wherein these areas they tend to have a lot of redness and congestion. They can have a bit of peeling of the skin. So the people who have these kind of this kind of appearance of the cheeks, this can lead to um, changes in the eyelids as well, and this is called blepharitis. So the blepharitis can also happen in the superficial part of the eyelids. That is, immediately when you look at the eyelashes closely, you will see those particles. They can happen behind also. So that is anterior and posterior. So the posterior one is mainly to do with the glands that we mentioned earlier, which can appear covered and capped and blocked. So when the oil glands are blocked, this can also lead to some amount of congestion, um, dry eye. So dry eye is something which is also assessed when we examine the patient, and during that assessment we mainly check how much tears are there in the eyes, how the glands look, the openings of the glands, what kind of secretions are coming from the glands, and basically the tear film, like we assess how long the tear film can be sustained, the measurement of the tears. These are the things that we do. Now, we have described regarding blepharitis. Now we'll talk about how we can treat blepharitis. So the number one thing So you may have understood that since these particles are there on the lashes, they need to be cleaned. So eyelid hygiene is a big part of treating blepharitis. And because there are these crusts which form around the eyelashes, they need to be treated by something called warm compresses or hot fomentation. So basically, warm water is taken in a bowl, a clean towel is dipped in that, it is squeezed, and it is placed over the eyes for about 5 to 10 minutes. This causes the crusts to sort of become softer and easier to remove. Once the crusts have been softened, you can take some dilute baby shampoo like Sebamed or Johnson's baby shampoo, any of these baby shampoos. Mix it with some water, put a clean uh, cotton pad in that, and you can just wipe off the crusts and the dandruff particles which are there on the eyelashes. Along with this, it would actually help if you could do a gentle eyelid massage. So once you've done all of this, if you can just massage the eyelids a little bit from up to down and from down to up, that sort of helps the oil glands also to work well. The oil glands which are positioned vertically in the eyelid margins. Now, this is basically a basic treatment that we would give anybody who has blepharitis. But once we identify different causes, then we would want to give other treatments as well. So this would include a antibiotic cream. So if we suspect some kind of bacterial infection, then an antibiotic cream will also be prescribed by your ophthalmologist. So the cream is basically applied like a kajal around the eyelid margins, and it's only applied once a day. So after you clean off your lashes and do your warm compress, just apply the ointment at night time, and that should be the last thing that you do, because once you apply the ointment at night, you tend to get a bit of um, stickiness and little bit of blurring of the vision because of the nature of the cream. So that should be the last thing that you do at night. So ointment is usually prescribed between 2 to 6 weeks, and it should be done along with the eyelid cleaning. The other thing which is done is if the blepharitis doesn't respond to ointment or doesn't respond to basic treatment, then you may have to be started on oral medication, that is tablets. So that is antibiotic tablets. Now the antibiotic tablets are not only fighting against a possible infection in the eyelids, they are also used against the uh, oil formation which is caused along with the blepharitis, as well as the inflammation which is caused. So the antibiotic is not just functioning against the bacteria, it also has an anti-inflammatory and a lipid regulating function. Now, like I mentioned earlier, the another cause of blepharitis is a parasitic infection. Now, this is basically a mite. It's called Demodex. So, Demodex is a mite which sort of buries around the follicles, around the root of the lashes, and that leads to a formation of these dandruff particles around the root of the eyelashes. So, when there is a suspicion of Demodex, or if your eyelash has been sent as a sample to the lab and the lab has identified that you have this Demodex infection, then you would be started on products which contain tea tree oil. So tea tree oil functions well against Demodex, and these come in tea tree oil shampoos. So these again you have to dilute and then wipe your lashes in the same way, or they come in the form of wipes. So how you have wet wipes, the same way there are sterile eyelid wipes which contain tea tree oil. So you take the wipe and then you clean your lashes. Certain other conditions such as meibomian gland dysfunction can coexist with blepharitis. So the meibomian gland is what we talked about earlier, where the glands are blocked and you need to do some warm compresses to open up those glands. Those glands can also be opened up by something called intense pulse light therapy. So there are certain machines. One of them is called LipiFlow. So what it does is it sort of is kept around your eyelids, and it not only massages and pumps the secretions out of your eyelids, it also gives a warmth. So intense pulse light therapy. So that's a thermal therapy around the eyelids. So there are certain number of sittings which you may require for that, but that tends to help in the symptomatic improvement of dry eye as well, which can happen because of this. Now, certain conditions can appear like blepharitis, and before you diagnose it yourself at home, it's important that you go to an ophthalmologist so that they can rule out other conditions. So this can range from just a style, which is like a pimple on the eyelids, which can be treated differently, or it can be something even in older people. Blepharitis can be a sort of imitating something like cancer. So cancer is something which has to be ruled out when blepharitis recurrently occurs in older individuals, that is in the senior citizens. So they may have distortion of their eyelid margins, loss of lashes. So this has to be differentiated by the ophthalmologist. Whenever blepharitis occurs chronically, we mentioned that it can be an acute or a chronic situation. So when it occurs chronically, after you treat the blepharitis, it can come again and again, even after periods of treatment. So this is something which you need to be on follow-up for, so that you can be on the basic treatment and the maintenance treatment to avoid these exacerbations. So, along with the ophthalmologist, sometimes the ophthalmologist may involve the microbiologist, like I mentioned, for the diagnosis of Demodex. And the other thing is, you might want to involve a dermatologist in the skin condition, which I mentioned, the redness of the skin with the flaking, and the seborrheic condition, that is rosacea. So, you may be asked to visit a dermatologist as well for further management of the skin conditions. So, that's all about blepharitis from my side. I will just address a few of the questions. One question is, what foods do you avoid if you have blepharitis? So there's no food as such to avoid. There's no food which causes blepharitis as such. It's mainly what you have to follow is lid hygiene. So I would say lid hygiene is the main thing that you should focus on in order to prevent blepharitis. Or if you have blepharitis, lid hygiene is the primary thing. Otherwise, a balanced diet which contains all the essential nutrients and supplements and vitamins is more than enough. The next question we'll take is, what happens if you leave blepharitis untreated? Okay, so if blepharitis is allowed to continue, there will be further and further inflammation of the eyelid margins. This can cause a lot of scarring and loss of lashes. So, number one, cosmetically, it will be disfiguring for the eyelid. Number two, this scarring can cause even more dry eye. And number three, the patient would suffer a lot. So, um, we would anyway put the patient on lubricating eye drops and supportive treatment like gels, in addition to all the antibiotic therapy. So, if you don't treat the blepharitis, you can get severe dry eye, and you would anyway be quite symptomatic. So, usually blepharitis doesn't go untreated, because only in very early stages it does, but in the later stages patients usually, it's necessary for them to come purely because of how symptomatic they are. The next question we have is, what is the main cause of blepharitis? So like I mentioned, the main causes are usually a bacterial infection or rarely a viral infection, otherwise a parasitic infection. And these skin conditions and seborrheic conditions. So people who have a lot of dandruff, they tend to have uh, deposits of uh, dandruff or these scales along the eyebrows as well as the eyelashes. So that can be one of the causes. Or the rosacea, that is the skin condition which can cause blepharitis. How do I get rid of blepharitis permanently? So, like I mentioned, that it can have recurrences and exacerbations. It's difficult to get rid of blepharitis permanently, but how you could maintain the status after treatment of blepharitis is that you maintain good lid hygiene. So, clean your lashes. So even during your bath, you can just focus on your lash cleaning, not rubbing it very hard, but just making sure that those eyelashes don't have any dirt or any particles stuck to them. So that can be done. And the wipes which I mentioned, there are wipes with and without tea tree oil. So in the evenings, you can always clean your lashes with wipes. Coming to the next one. Yeah, so these two we answered. What happens if you leave it untreated, and how do you get rid of it? So that's it for today's session, and I hope it was useful for everybody and everyone got some idea as to what blepharitis is and when they need to come into the clinic and what we would necessarily do for them. Thank you.